Welcome to Stop Falling, Start Living. We measure blood pressure using two numbers. These are called the systolic, the higher number, and the diastolic, the lower number. An average person will have a blood pressure reading of 120/80. To make things simple, let us imagine the heart is a pump and the veins and arteries are pipes. When the heart is pumping, the pressure in the pipes increases and we get the higher number, the systolic number. When the heart is at rest, the pressure in the pipes lowers and we get the lower number, the diastolic reading. There are times when the readings can be too high or too low, and these can change with age, chronic diseases, injury, alcohol, tobacco, and diet, to list just a few. If the blood pressure is too high, this is called hypertension. Causes of high blood pressure. These can be narrowing of the blood vessels, the arteries and veins, diabetes, and long-term kidney infections, just to list a few. Signs and symptoms of high blood pressure can be headaches, shortness of breath, and nosebleeds. Treatment of high blood pressure can range from lifestyle changes, diet, and medication, to list a few. If you suspect you have high blood pressure, ensure your GP is aware of this. If the blood pressure is too low, it is called hypotension. Causes of low blood pressure can be blood loss from injury, dehydration, diabetes, thyroid problems, and some heart problems such as irregular heartbeat, to list a few. Signs and symptoms of low blood pressure can be dizziness, fainting, blurred vision, nausea, palpitations, this is rapid irregular heartbeat, just to list a few. Treatment of low blood pressure can range from drinking more water, wearing compression stockings, and medication. We can also raise someone's legs, but this is normally a first aid measure only. If you feel that you have low blood pressure, ensure that your GP is informed. Postural hypotension. Postural hypotension can occur when the blood pressure drops when moving from lying to sitting and sitting to standing up. Management of postural hypertension is quite simple. When getting up from lying down, sit at the edge of the bed or sofa for a short while. If you feel dizzy, lightheaded, etc., you can always lie back down until you feel better. When getting up from sitting down, stand at the edge of the bed, sofa or chair for a short while. If you feel dizzy, lightheaded, etc., you can always sit back down until you feel better. If the feeling of lightheadedness or dizziness persists, you should call your GP or 111.